Hi, everybody. This is Dave Sheen from the Wellness Project. Next episode, I'm very excited to be speaking with Ruth Werner from Oregon, USA, whose article titled COVID-19 Related Complications, Implications for Massage Therapy, is something that's become available on our members-only website. And I'll be speaking to Ruth about the article, so tune in. Hi, everybody at home. Dave Sheen here from the Wellness Project. Today, I'm very excited to be speaking to Ruth Werner over in Oregon, USA, whose article titled COVID-19 Related Complications, Implications for Massage Therapy is available on our website in the Members Only section, and in my opinion, a must-read for all Massage and Myotherapy Australia members. Ruth is an educator, writer, and retired massage therapist with a passionate interest in massage therapy research and the role of bodywork for people who struggle with health. Her groundbreaking textbook, A Massage Therapist's Guide to Pathology, was first published in 1998 and is now in its sixth edition, now in its seventh edition, and it's available through Books of Discovery. And I think Ruth has a copy there that she can show in a second.
I do.
There you
right
go.
Here.
Interestingly enough, back in 2003, when I did my diploma, massage diploma, it was Ruth's book that was our text for pathology. So I'm really super excited to have Ruth on the show and to meet her in person for the first time. Ruth was also named AMTA Member of the Year Award in 2005 and also served as the Massage Therapy Foundation trustee from 2007 to 2017, as president from 2010 to 2014, and also received their 2018 Distinguished Service Award. Welcome, Ruth. What a mouthful.
Thanks very much. Well, those are the standard things we're sort of expected to put into our short biographies here. So you did an excellent job of rattling all that off. Well done.
Thanks so much. So we're here today to talk about the article, which has been originally published in the ABMP in the USA, in their journal. And we managed to cite that and ask permission to have it put into our members section, because considering the times that we're in, it seemed incredibly relevant to where we're at all around the world, not just in the US and Australia. So in the article, you talked about how it was written at the beginning of your summer, which is a few months ago now. So my first question, and it can be just a fairly quick response if you like, have things changed much? Because early summer for you would have been, I'm assuming, sort of April, May?
June-ish, I think. If I try to remember, I think I wrote that mostly in June. I'd have to go back and look.
Yeah.
And there have been some changes. There have been some sort of shifts in focus or where people are putting their attention for what they're worried about. And I think some of that is relevant for us. So I'm happy to have a chance to talk about that a little bit. You know, back in the earlier part of trying to come to grips and understand this infection, for me and for many massage therapists, I believe a big point of focus was on issues around coagulopathy, right? And scary, silent, uncontrolled, possibly deadly levels of blood clotting. And this was a cause of death for a lot of people. Continues to be, but is a cause of death for a lot of people, is organ failure, because their organs are basically shut down because of this wild, out of control blood clotting mechanism. And so there was this huge open question about, is this also a factor for people who are not at death's door, right? Is this a factor for people who survive COVID? And if yes, for how long? And if yes, how can we possibly know when massage therapy may or may not be safe? And, since I wrote that article, and in fact, the article that preceded it in the previous edition of Massage and Bodywork magazine was specifically on coagulopathy. Since I wrote that article, I've had the opportunity. I had a wonderful chance to have an interview with a hematologist. I have had a chance to press some other medical professionals about the blood clotting risk. I've listened to a gazillion people talk that that I wasn't interacting with, but other
Sure.
people talking about consequences relating to COVID, and virtually none of the experts that I have spent time with have expressed a high level of worry about blood clotting for people who are not already very, very, very sick.
Sure.
So it's not unheard of
Mm.
that people who have mild infections then develop some blood clotting abnormalities. And it turns out that that's not exclusive to COVID. We see blood clotting rates go up with any kind of sort of severe infection, including things like flu. But the sort of ticking time bomb attitude that I certainly had about it, and many other people had about it, appears to be less. I don't want to say it was an unfounded fear, because it opens questions that we must ask of our clients. But it is probably an overstated concern and not that difficult to mitigate for if we ask, the right kinds of follow-up questions.
Yeah.
So that's been one change, is that whole blood clotting risk is not gone, but it's probably less important than we thought.
Sure.
Yeah, and that's excellent news for us, right? The other, big thing that's really changed in my tracking of what we understand about this infection is really refinements about the nature of that overblown inflammatory response. Is it all cytokines? Is it bradykinins? Is something weird happening with carbon monoxide poisoning? These are all things that fancy people are discussing. They have much less implications for what we do with our hands. So I track it because I'm interested in that sort of thing, but it's not the kind of thing that will necessarily influence our choices.
Now, you've mentioned one of the three key factors that you talked about in your article, which is that inflammatory response. There were two other factors, viral attack and immune system response. So did you want to kind of unpack that for the audience about how those three contribute as a whole, if you like, in respect to how that can then become the life-threatening condition itself through those three processes?
Yes, thank you. And I want to I want to just say how gratified I am that you picked up on that as you read the article. And when I teach this material as in webinars and whatnot that I've been doing a lot, the slide with these three things is the slide that I say, if you don't remember anything else from this webinar, here's what I want you to get, right? So there are three ways this infection causes damage. And they are, as we see with any other viral infection, we have a direct viral attack on the target cells. And when the virus gets inside those cells, it retools them, as viruses do, to turn them into virus factories. This is how viruses work. One of the peculiar things about this virus is it is attracted to lots and lots of different kinds of cells because its entry point is very, very common. With something like hepatitis or HIV or other viral infections, there are specific groups of cells that attract those viruses, but with SARS-CoV-2, it's any cell with an ACE2 an ACE2 receptor site, and those are all over the body. They are everywhere. Yeah. So we have the virus getting into the cells and killing them. We have a normal and completely appropriate aggressive immune system response against this happening, right? And so we're familiar that when you have a cold or a flu, your symptoms are only partly caused by the virus. They really are more due to our normal, healthy, aggressive immune system attack against them because when an infected virus waves a white flag to say, "Oh my, I've been invaded," then white blood cells come and they kill it.
Sure.
This is what's supposed to happen, and that happens in COVID-19. But what we see and what appears to be the distinguishing factor between people who get it and get sick and get better and don't have long-term consequences, and people who get it and get sick and then might die, is this, pardon me, I have a cough. It's part of my life. I don't have COVID. This distinguishing feature appears to be this absolutely wild, out of proportion, hard to get on top of inflammatory response to the presence of this virus. So it's above and beyond a normal immune system reaction. It's a crazy, out of whack, self-sustaining inflammatory response that causes damage everywhere. And the reason we see so many different kinds of symptoms with COVID, especially for the people who have long-term, we call them, I don't know if you're calling it long COVID or what, we call them long haulers here.
Sure.
You know, and there's this huge spectrum of symptoms that people may have. It could be gastrointestinal, it could be horrible headaches, it could be neuropathy or numbness or loss of sense of smell or whatever. And these symptoms, they come and they go and they're unpredictable. And really what they are reflecting is where these out of whack, out of proportion inflammatory responses are happening, what tissues they are affecting. And you know, and I think that as we come closer to really understanding this virus better, one of the things that we are looking for is it possible to predict who's going to have this out of whack, out of proportion inflammatory response, because those are the people who should be protected most carefully, as opposed to the people who have it and it looks like a bad cold or flu. And then they get better and they don't seem to have long-term repercussions. However, we don't actually know what the long-term repercussions will be, even for people who have mild disease, because when we do tests of things like the health of heart cells or pulmonary function, even without symptoms, we are seeing signs of tissue damage. And so
as time goes on, we're seeing there's more evidence to show what you're talking about. But we need that time to see, right?
And we will, and so if an otherwise healthy 35-year-old has COVID, recovers, that's wonderful. That's terrific. But in 20 years, what will his lungs look like? Because we're, considering the possibility of things like pulmonary fibrosis, which is a miserable condition, or cardiomyopathy. And we'd have no idea what those long-term repercussions are yet. And I don't want to sound alarmist about this, but I also don't want to pretend that we're all going to be okay, because we don't know.
Well, it's interesting because in Australia, and I'm assuming the same as overseas, that the perception from younger people is this is an old person's condition. It's if I get it, I will have very, very mild symptoms. But as you're indicating, and what the science is starting to show, is that there are people who are of a younger age who potentially down the track will have major repercussions from the actual condition itself. Yeah,
we have to consider that as a possibility. Some of that research, specifically about cardiomyopathy, has been done on young athletes, who would otherwise be considered to be the cream of the crop in terms of heart health.
Alzheimer's is getting a real run in Australia in the media as well, talking about from a neurological point of view as well, that there's potential for an increase in that down the track, because it will only come out further down the track. We need time to actually see the evidence.
We don't know, and it would be great if this all turned out to be something like the blood clotting risk, and it's something we watch for, but it is not as big an issue as we had worried about. But it would be premature to make that prediction at this point.
Absolutely. Now, your article, you've mentioned one particular condition. You've listed a number of other ones, but the cool thing about the article is you've looked specifically with a focus on the repercussions or the implications for massage therapists and the way in which they should go about treating their clients. So to kind of tie up the interview today with you, Ruth, so did you want to speak? We've spoken in terms of the science and the literature. Did you want to talk a little bit about some, I guess, some not so much tips, but some considerations that massage therapists should take on board in treating those that have had COVID? Because you do talk about that in the article.
Sure. Thank you for that. Pardon me, for that opportunity. And I don't know if maybe you can answer this, Dave, with the version of the article that you are sharing with your members, is there also a link to a video?
No, there's not. No, I don't think there is.
That's fine.
We can always add that into the members section.
You'll have to take that up with ABMP. I submitted with it just a short video of going through some screening questions. So I will be happy to share some ideas about some suggestions for working with people who have had COVID. This has to come out with the caveat that I'm not in practice. And so I am speaking, I mean, I used to be, but I'm not right now. But so I come to this from a different perspective than people who are up to their elbows in working with people every day. And I absolutely acknowledge that. And B, we are working now with a completely novel population of people who have survived this infection. We don't know what their needs are. And no one is really doing a lot of research because we have people who are dying first that we have to figure out how to help, right? And it's been astonishingly frustrating to see how these long haulers, these people with long-term repercussions of the disease, are treated by the medical community, because a lot of people are just abandoned. And I don't know if that's as true in Australia as it is here, but it's a point of great sadness to watch. So let's say you're a massage therapist and you have a client who is a survivor and you want to have some ideas about working safely with your client. The two, for my money, the two most important questions that you can ask after you have established that your client has been cleared of any risk of communicability.
Of course, yes.
Right? Yes. Which is an open question because we actually don't know.
We're talking about contagious. More an issue of being contagious, yeah?
Right. So let's say you both are satisfied that your client is no longer contagious. All right. The two most important questions, to my point of view, are are you taking any medications related to your infection? Because if they developed serious complications, they will probably be medicated for it, including coagulopathy, because people are actually being put on prophylactic doses of anticoagulants, in the States at least. And that's intended to be temporary, but that's important information because that might change the way we want to work with people. Mm-hmm. Okay. So are you using any medications related to your infection? And B, tell me everything about your activities of daily living. Because if your client has been physically sidelined by their infection, if they used to run many kilometers a day and now they can barely walk around the block, that is a very, very important piece of information.
Sure.
And to say, tell me about the kind of exercise you get, and how do you wake up feeling rested, and what are the kinds of things you can do with comfort in the day, and what are the kinds of things that are really hard for you to do during your day. And I think we need to gather this information so we have a really clear idea of what our clients' if I say allostatic capacity, do you know what that means?
Well, you explain it to
It's a
the.
word that a lot of people don't use, but it really has to do with their capacity to maintain homeostasis,
Mm.
right?
And
So
that and
homeostasis
that's
is
that varies from person to person, with their
exactly.
lifestyle, and yeah, exactly. It's a very important
Yeah,
point, because if you've got, as you said, if
and
you've
yeah,
got
and the way
someone
we talk
who's,
about it is,
if you've
go
got
ahead.
someone who was super fit prior to getting the actual disease, and then afterwards having, as you mentioned, having lowered lung capacity, etc., then there's an obviously indicator there that there has been some effect on that particular part of the body.
Yeah, exactly. And so, another way to think about this is as resilience. We need to get a sense of what our clients' resilience is, because massage creates a demand for adaptation. And so if our client's resilience is very limited, then we must not create a big demand for adaptation. And if our post-COVID client is fine and great and back to normal levels of activity, that's really good news. I still really recommend starting very conservatively
Mm.
and working incrementally up to pre-COVID levels of intensity. If this is a client who you used to work with before and then they got sick and now they're better, I just until we know more about this disease, my inclination, because my job is to be conservative about such things, my inclination is to advise people to start with lighter pressure, maybe shorter sessions. Um, do a follow-up call in between your appointments to see if there was anything unexpected. For instance, if a client develops bruising, that's really important information because something is happening with their blood clotting. If a client develops chest pain or has cramps or something like that, that also might indicate something about cardiorespiratory
Sure.
function.
Mm.
But if a client says, "Oh, I slept great for the first time since March and I woke up without back pain," and those things, that's the kind of feedback we're eager to hear, but sometimes we have to go after the information that maybe people don't want to tell us because it might not sound so good. And then the third thing I would recommend for everybody is, please, I'm begging you, document everything that happens.
Mm.
Because one of the things, because we are dealing with a whole new population, this is an incredible opportunity for massage therapists who are really good at documentation to maybe consider writing up some case reports that could then feed into our more general knowledge about the intersection between massage and COVID. Um,
And in
so
fact,
those
interestingly
are,
enough, and I'll just pull in there that a lot of the conditions that you talk about in your article are of a physiological nature. But one that really stood out for me, because this show is called The Wellness Project, and the focus for
yes,
us is also on mental health. So you did
yes,
touch on that as far as mental and mood challenges. So again, that's
yeah.
from a point of view of benefits of massage. That documentation could certainly assist in the promotion of the industry itself, right? And as you said, from a case study point of view, it can potentially validate and give strength to what we do.
Well, if we fix it so we're not all, pardon me, we're not having each one of us to recreate the same wheel. Um, I'm glad that you brought that up, because one of the things that I find most compelling and sort of moving about the experience of people who have a bad experience with COVID is the anxiety that accompanies having problems with breathing.
Hmm.
And as someone who lives with a chronic cough, I totally get this.
Okay.
Um, I have to be very, very careful about the speed and fullness with which I breathe, because otherwise I can't. I cough.
Mm.
For people who feel anxious and who have had a lung infection and whose anxiousness is expressed or manifested in terms of how they breathe, and we know that restricted breathing can boost anxiety, this becomes a self-fulfilling prophecy that's
Mm.
and a vicious circle that's very hard to break out of. And you know who can help people break out of that vicious circle is massage therapists, right?
Absolutely.
And
Yeah,
our
yeah.
ability to create calm and to work with breath in a way that doesn't challenge other systems in the body. This is an incredibly powerful intervention for people who are stuck in that circle of anxiety and breath problems.
And even if you take
I
it back
think
a
that,
step from that, you're talking about breath, etc. Even the issue of isolation, and this goes for both
yes.
those with and without COVID. I mean, in
Mhm.
Melbourne at the moment, I'm still sitting here in lockdown, unable to hug people except for people in my own house. And I'm lucky I have people in my own house. But that whole issue about touch comes into its own
Mhm.
when you talk about massage.
Yeah, it is. And be prepared to get a little weepy about
Yeah,
that.
yeah.
I have a dear friend, a neighbor with whom I've sort of bubbled, um, and yet, so we visit a couple of times a week, but we don't get close to each other and we don't touch. But there was one day that she was in a lot of pain, and we were outside, and I stood behind her, and my hands were clean, and I worked through her clothing, but I rubbed her shoulders for 15 minutes,
Hmm.
and it was among the most moving moments in massage in my life.
There you go. Yeah,
Uh,
yeah.
and it was, yeah, and people are starving. They are
Mm.
starving for touch.
Absolutely.
And so we have an important role to play as soon as it's safe. And in the United States, of course, we have opened those gateways in many places prematurely, which has put so many people at risk.
Mm.
So I appreciate the that you guys are being more circumspect about it, and I hope that your reopening goes much smoother than ours has.
True, absolutely. Ruth, I'm looking at the time. We could speak forever, but I'll get my knuckles wrapped if we go on much longer. So we might wrap it up there. It's been absolutely a treat to have you on the Wellness Project. So again, many thanks for your time. And do you want to hold that book up again?
Yes.
So it's in
So
its seventh edition, and I'm sure
yeah.
it's
So
available
here
here in
is.
Australia from someone somewhere. We can, if you Google it,
Oh,
guys at home, I'm sure.
Books of Discovery has ways for you to get it. It's also available as an ebook, so you
Ah,
could get
okay,
it instantly. In addition, I have a new podcast
okay,
called "I Have a Client Who,"
yeah,
and it's available. It's published by ABMP, and so if you have a little story to share, anyone who's listening, if you have a little story to share about something interesting that has come up mid-session with a client through a filter of pathology, please feel free to share that with me. You can contact me at my website, which is just ruthwerner.com. And do give the podcast a listen. I'm really proud of it. It's really fun.
okay, brilliant. I'll certainly get onto that. That's great, Ruth. Well, again, many
Great.
thanks for your time, and hopefully we'll catch you again sometime.
Good. I would really enjoy that. Thanks, Dave, and thank you to everybody who has listened to us.
Thanks, guys, for listening. We'll see you next time.